Good afternoon, everyone. This is Dr. Al Sayed. Just wanted to give a quick update on the COVID-19 crisis. As everyone's aware, this is a pretty fluid situation with constant evolution of the situation. Just a quick background, as we're all aware, most common symptoms, fever, cough, shortness of breath. There's a incubation period that ranges from anywhere 2 to 14 days, averaging about 5 days, spreads primarily by respiratory droplets, and it survives for hours on common surfaces, and hence the recommendation for social distancing, frequent hand washing, and cleaning common surfaces. Now, there is a concern with a few studies and observations because of the rapid spread that there might be airborne transmission, meaning that these droplets are actually surviving in the air. So an infected person might be leaving these droplets, they might be hanging out in the air, and unsuspecting individuals may be picking up these droplets and getting infected and spreading the infection to others. And that would be a serious threat, obviously. Now, some facts, because there's a lot of misinformation out there. What we're seeing so far is that overall mortality worldwide is at about 2 to 3% compared to the 0.1% for influenza. And I just want to show you a graph. I know it's going to look backwards to you, but really age is very important. Age and comorbid conditions. So as you can see, the younger the individual is, the better the prognosis. But who we're really concerned about are those who are age 60 and older. And once you're over the age of 80, you're talking about 15% or higher mortality. And that's very, very disturbing and concerning. So, World Health Organization declared a pandemic on March 11. A couple days later, President Trump declared a state of emergency. If you're following the news last night, Governor Newsom of California effectively put the state under lockdown. This morning, Governor Cuomo of New York put most of the state under quarantine. And it's probably only a matter of time before our area here, the Northern Virginia area and surrounding DMV, goes under a similar quarantine. Earlier this morning, travel restrictions were instituted between the U.S. And Mexico. There's a travel advisory that's been issued against any international travel. There's a risk that if you decide to go on any international trips, that you may not be able to come back, especially if the travel restrictions are extended and there's a broader ban against any re-entry. So some numbers, and these are always fluid. So as of this afternoon, the CDC reports that there are about 15,219 cases in the U.S. with 201 deaths. 1 in DC, 2 in Virginia, and 1 in Maryland. And these numbers are accurate as of 4 p.m. yesterday. So if you want to look at this graph to kind of see when we first started reporting in mid-January, and you can see there's exponential growth in the number of cases. And this is why when I'm talking about this possibility of airborne transmission, it's very concerning, because a suspected case who's infected leaves these particles in the air, and we don't know this definitively. There are those who are arguing in the medical community that there's no airborne transmission, but there's considerable patterns that are suggesting that this is actually the case. Number of those tested so far by the CDC are a little over 4,500, by other laboratories close to 50,000. But as you can see, the U.S. population is about 330 million. So we are sorely under testing. We don't have enough capacity to test, unfortunately. We don't have enough capacity to test in the U.S. And that's a problem, because if we're talking about being able to control the number of infections and the spread, then we need to be able to test many more patients. So we have a twofold problem. We have a highly contagious infection with a relatively long incubation period, and we have a lack of widespread spread testing to identify the positive cases and isolate them. So we have two possible trajectories here. One is exponential increase in the number of infections along with deaths like Italy saw, or rapid control of the situation and what's being referred to as flattening of the curve, such as what we saw in South Korea. The data currently is indicating that if we continue with our current approach here in the US, we are walking right into the Italian scenario. And I want to show you a graph that is showing this. I'm not sure how clear this is going to be, but let's try and see. If you look here at this red line, this is what happened in South Korea. They had rapid increase, and this is just 10 days into to their epidemic, and they started to flatten the curve. But if you look here, this long line that's going up here, this is Italy, and this is where they just kept going straight up, and this is where cases were doubling every 3 days. And this line here is the US, and we're following that trajectory where we're doubling cases almost every 3 to 4 days. Doubling cases every 3 to 4 days. So that's not a good indicator. So what was the difference between Italy and South Korea is that South Korea had widespread testing, strict isolation of positive cases, and mandated quarantine. And it's not fun. We like to have our freedoms. We like to be out and about and do what we want. But that's how they were able to get the situation under control. And if you look at Italy versus China, you've got a country, Italy, a population of 60 million, China with a population of 1.4 billion, yet the death toll in Italy has already exceeded the death toll in China. And China has already declared that they already had their first day without any new cases. So we really have to change our approach. Now, all of that is on a grand scheme of things that is beyond what we as individuals can do anything about. This is, government and healthcare and all of that. And even we as physicians are having a hard time. I'm getting slammed with patients asking what they can do and where they can get tested, and I'm having a hard time referring them to where they can get tested. The question is, what can you as a patient do and what can we generally in the public do? So social distancing and frequent hand washing cannot be overstated. That just goes without, that's non-negotiable. Now, for those who are over the age of 65 or have chronic medical conditions or immune compromised, my recommendation is you just have to go into self-quarantine. You just have to go into self-quarantine. No grocery shopping, no family visits, no grandkids coming around. You should have younger, healthier family members or neighbors taking care of your shopping, getting your medications, going out and getting whatever it is that you need. At this time, you really should be staying home. You can go out and take a walk in the neighborhood if you need, a change of scenery, fresh air, but keep a distance from others. This is critical because it is this category of individuals who are at risk of complications from this infection. Everyone else, the young, those who don't think that they'll get complications from this infection, that'll be passing, because there are studies out there that are expecting that over 200 million Americans are going to get infected. Over 200 million. That's 2/3 of the population or more. So for everyone else, stay home as much as possible. If you're able to work from home, please work from home. Venturing outside really should be limited to the bare necessities. You got to get some groceries, go outside. You need to go to the pharmacy to pick up some medications, do that. But there should be absolutely no leisurely shopping, going to the mall, going out to watch a movie, eating out at restaurants, play dates, family visits. All of that stuff really should be on hold for now. Going to the gym, all of these kinds of things should be on hold because they are not essential. And remember, there's that period where you may be asymptomatic but carrying the infection. You may not suffer from the infection, but you can transmit it to others. At the same time, don't forget about your older family members and neighbors who may not be able to venture out, may need your help. Keep an eye on them. Bring them their needs, their groceries, their medications, whatever they may need. What if you have symptoms and you're worried and you're not sure? If you have a sore throat, congestion, a runny nose, diarrhea, most likely this has absolutely nothing to do with this COVID-19. But you should still stay home until your symptoms resolve. We don't have a good way to test everyone. It's just not accessible. So if you have any upper respiratory type symptoms, stay home until you're symptom free. Now, if you have just a cough and fever, assume that it may be COVID-19 related, but call your doctor's office. Don't run to the hospital. Don't run to the urgent care, because you're potentially exposing other individuals to this infection if you have it. So pick up the phone and call your doctor's office. Now, if you have a cough, fever, and shortness of breath, then it's very likely that you do have COVID-19 and you need to be evaluated in the emergency room. And the reason you need to be evaluated in the emergency room is because you have shortness of breath, you may be developing pneumonia, and you may need respiratory support. But before you go there, please contact the emergency room to find out what their protocol is, because a lot of the emergency rooms, virtually all the emergency rooms, are overloaded right now. So they've changed their protocols and they've been given leeway. They don't have to evaluate all patients that come through the door. So they've been given leeway. Some emergency rooms have now closed down their doors. They've set up outside makeshift tents where they're evaluating patients. So make sure you call them to see where they want you to go so you can minimize exposing other patients and staff. Now, if you don't have symptoms, life still needs to go on. If you have a regular appointment scheduled with your doctor that's not illness related, or you need to follow up with your doctor because of your blood pressure, your diabetes, a well child visit for your kids, things of that nature, consider telemedicine, meaning reaching out, having a visit with your doctor, the way this communication is happening right now by video chat. And this way, a lot of doctors' offices now are offering this because it minimizes your risk of being exposed if there are ill patients there, the risk of exposing other patients if you're carrying this infection and you don't have symptoms, and also the risk of exposing the physicians, the nurse practitioners, the physician's assistants, the other staff that are at the office, because if they're out of commission, we're going to be in serious problem. We're not going to have enough healthcare workers to take care of the patients. So contact your doctor's office before you just go out there and venture and try to be seen. They may have that option. Here at LSAT Primary Care, we're transitioning all our care for our members to virtual telemedicine visits until we feel that it's safe to resume in-office visits, but we continue to enroll patients, and telemedicine visits are part of the membership. There's no extra charge for it. So many doctors are offering these kinds of services. Reach out to your doctor's office and let them know that you need to be evaluated. They're not going to abandon you. Finally, stay informed, avoid panic and unwarranted fear. The worst thing that you can do is to panic and go out and start hoarding things and being inconsiderate towards your neighbors and friends and community. We need to be in this together. We will pass. This will pass, but we need to stick it out together. And please be sure to keep an eye out on our page, as we'll do our best to keep you updated. And if you have any questions or comments, things that you want us to address, you want me to comment on, please put them in the comments, and I'll do my best to address them in upcoming feeds. I'll do my best to keep these as regular as possible. Thank you very much for tuning in.